This is really informal, so any questions that you might have, feel free to ask them. I do want to say you must sign in to YouTube in order to ask your question. So once you sign into YouTube, of course, you'll see us on your screen, but there's a box on the right hand side of the screen and basically it just says ask questions. So you can just type in that chat box your questions and we'll answer those throughout the taping of this. We do want to let you know there is like a 30-second delay. So, when you type your questions, it might be a minute or so before we actually get to it, but we definitely will get to it. Again, we want to thank you for joining us. If you have any questions during the broadcast or have any technical issues, let us know. My name is Sean Boyd. I'm the coordinator of student affairs, and I'll be talking about basically how to apply to the program, nursing CAS, any admissions questions that you might have. I can definitely answer those. But our main person, I'd like to say to start the show, is Dr. Diane Pace. So she's going to talk about our DNP program and some of the different concentrations and answer your questions about the program as well. I'd like to welcome her.
Hi, so glad that many of you are going to be able to join us today. We're so excited to be able to share our program with you. I'm actually a two-time alumni of the University of Tennessee College of Nursing program. So not only am I the current director of the DNP program, I'm an alumni, so I'm very passionate about this program and believe we have one of the best programs in the nation. So I'm looking forward to hearing your questions. Let me just very quickly give you a quick overview to the program. I'm sure you've been on our website and have looked at our programs, and I'm sure you've got some specific questions, but very quickly, our DNP program is very extensive. We have 6 main options. We have the CRNA or the nurse anesthesia program, the family nurse practitioner program, the acute gerontology, acute nurse practitioner program, the neonatal nurse practitioner program, the pediatric nurse practitioner program, and the psych nurse practitioner program. We also have a couple of dual programs where you could become board certified in both the family and acute care nurse practitioner program so that you can enroll in a dual program or the family and psych nurse practitioner program. So lots of options for you to be able to ask questions about. So I guess maybe that's just a quick overview, and I think probably the best thing to do is just to open it up and hear the questions that you might have. And if indeed we can answer your questions, and that's a possibility, we can write those questions down and get you the answers and email you back. So okay. Sean, I'll turn it back over to you.
Okay, and what we'll do is, like I said, just make sure you sign in and ask your questions. You do have to sign into YouTube. And like I said, the chat box is on the right-hand side of the screen. Don't be afraid to ask any questions. That's what we're here for. Just to let you know, our deadline for our DNP program is January the 15th of 2017. Wow, it seems odd saying that. Yes. But yeah, it'll be January 15th of 2017. Our CRNA is a little different. The deadline is September the 1st. So that's a different deadline from the rest of our DNP programs. But if you go to our future students page, it'll show you all the deadlines. When you click on a program, it'll show you when it's due and different things like that. Nursing CAS is the portal that we use for our DNP and all of our programs for students to apply to our different programs. Basically, Nursing CAS kind of walks you through. You can sign in. I always tell students don't wait to the last minute. Yes. Because Nursing CAS does take a little time to verify. So you want to make sure that you start early. I wouldn't wait until January the 10th when the deadline is January the 15th. So you can even start now. We actually will open up those applications March the 15th. This month, so they open up pretty early, and you can go ahead and start. You can log in, you can log out, you can work on some sections now, complete some sections later. It's pretty much up to you, but basically you'll submit all your transcripts. Everything goes straight to Nursing CAS, so you'll submit a request for your transcripts to be submitted to Nursing CAS, and whatever schools you went to, you have to request them from each school. So if you went to Southwest just for 2 courses in the summer or whatever it might be, you have to request a transcript from Southwest in your main schools. So transcripts are the main thing. Of course, letters of recommendation are very, very important. We ask that you go ahead and kind of start thinking now who you will want to write those letters, because the faculty and the committee, when they're doing the interviewing process, they really read those letters and really take
Yes.
them into consideration for you to get admitted into our DNP program. So just kind of start thinking now. I want to say it's 2 academic
That's
and 1 professional.
correct. And a professional, like a clinical professional, somebody that you have worked with in the clinical area. But definitely we look at your academic references. The academic means somebody, maybe a previous faculty that you have worked with. So do not hesitate to ask your academic faculty. Sometimes somebody say, well, I don't know how to go about doing that. So most of your academic faculty are used to writing those kinds of letters. We get those kinds of requests all the time. So we want to see what your academic faculty will say regarding the transitions and the way that you navigated your academic program. So we're very specific. So be sure you look at what those requirements are. When we look at your file, we look at how you have addressed the requirements in that academic file, and that sometimes will eliminate students who apply because they have not met the requirements in submission of their files.
Okay, and so pretty much your letters, you also do a personal statement, and that's very important too, because it really lets the faculty know why you want to be in this particular program. And of course, she mentioned earlier, Diane mentioned there's different concentrations. So we want to make sure that you know what concentration might fit you. And that's actually one of the questions. How do you know what concentration is right for you? Do you have any advice for students that might be?
Yeah, I think that's a very good question. And I'm glad somebody asked that, because we will read letters and sometimes students don't always even know what a nurse practitioner is. So please, before you write your letter, do your investigation, do your reading online. What is a nurse practitioner? What is the role of a nurse practitioner? Because if you're going to apply to a program, you need to know what that program is all about. What's the role all about? Some of you may have been, hopefully you have been, had your care provided by a nurse practitioner. That may be what's prompting you to seek out that role. Your care has been provided by a nurse practitioner. Some of you may have worked in a clinic as a nurse and you have been able to view the role of a nurse practitioner. Some of you may have said, I've heard about this role, and you have sought out a nurse practitioner and said, may I shadow you to see what it is that you're doing? Some of you may not even have a clue what that role is. Don't put that in your letter. Go seek out what that role is. I've read that. I don't really know what that role is, but, I think I'd just like to go and go to school and find out what it is. That is not the kind of letter I want to read, and that will not get you into the program. So in your letter, you should know what the role is and have some sort of idea about what sort of option you might like to have. Now, you may not really know, do I want acute? Do I want family? At least say in the letter, I've not formally decided the direction I want to go. I've been working in the hospital in acute care. I know that the acute care nurse practitioner is more likely, or that role, as I have studied and investigated, is working in the hospital. However, I also might like to work in a community-based sort of role, and I know the role of a family nurse practitioner does X, X, and X. And in my interview, I would like to talk with faculty and perhaps narrow it down what might be best for me. So at least I would know that you've investigated the roles, you know where they work, you know what the role is, but perhaps you may not have fully decided what might be best for you, and maybe you're thinking a dual might best for you because these are your long-term goals. You might want to say that in your letter, but at least your letter lets me know that you have investigated the role, you know where the roles work, you are thinking these are your long-term career goals, but maybe you don't know exactly where you might best fit, but you have done your homework. That's what your letter should tell me.
Perfect. This probably answers a little bit of what you just said. I'm assuming that this is maybe a DNP applicant that will be coming up for interview soon. She asked if you can give any tips for her to prepare for her DNP interview.
And I think it kind of answered that. Yes, in preparing for the interview, you should go to a variety of sites and see really what is the role of a nurse practitioner. You can go to the American Association of Nurse Practitioners and look at what is the role. How does it impact healthcare? It's more, what is the role in clinical practice? What is the role in health policy? How has that role changed? We have just celebrated 50 years of the role of a nurse practitioner. I'll tell you that I've been a nurse practitioner since 1976, so almost 40 years as a nurse practitioner in the very early years of that role. So I would expect that in the interview, you would not be asking me, well, I'm not really sure what a nurse practitioner does. Can you tell me? I would have expected that you would know what that role is and what your long-term career goals. Why did you choose the role of a nurse practitioner? You are already a nurse. Why now are you wanting to make the transition from your current role as a nurse and what you are doing in that current role to becoming a nurse practitioner? Why a nurse practitioner versus nursing administration, nursing education, nursing informatics? When I talk about nursing, there are so many opportunities in nursing now. Some people will say, oh, I couldn't be a nurse because I don't like blood. And I'll say, well, finish your nursing program and you don't ever have to see blood again in your entire life because nursing is so expansive. Well, the nurse practitioner role is only one area open to you. So you need to be able to tell me in the interview, why do you want to navigate down this role of a nurse practitioner when there are already so many other opportunities open to you as a nurse? You need to have already have done that investigation and homework. You need to tell me why you've chosen this role. And then you need to have gone beyond that and at least have some ideas, as I just said, why this option. You may not know kind of exactly acute care versus family or family versus psych, or do you want the dual, but is that maybe the best option? Because in the interview, we may help you kind of navigate, maybe the dual is not the best option because we know what it's going to take to be successful. Doing a dual program is somewhat difficult because you've got twice the clinicals, twice the didactic, and there are some things that will help you be successful and not successful. So that's kind of our role as the interviewer to help you look at those. But you should already know what that role is as a nurse practitioner and why you're choosing that role.
Perfect. All right, another question. This is coming from Erin.
Hi, Erin.
She said, for those of us who are already nurse practitioners,
yes,
can you give us some advice?
Absolutely. We feel very strongly in the College of Nursing here that the role of a nurse practitioner should be the DNP as an advanced practice role. We feel very strongly that that's exactly where the practice is going, and I'm so excited to know that you as a master's prepared nurse practitioner are looking at the DNP. You will be getting opportunities to look at a way of advancing the way that you think about your practice, the way you evaluate your practice. I'm sure you are a very strong clinician, and you are probably doing wonderful things already in your practice. What the DNP will help you do is to think differently about it, to integrate more opportunities for learning about theory, legislative, economics, evaluation of practice, and we hope you will finish the program with thinking a little bit differently. We hope that the clinical aspect that we will help you integrate will help you expand some of your clinical practice skills, and that you will finish the program even with much broader sort of skills in your practice. You'll be able to develop learning contracts with your faculty that will help say, you know, I'm doing this, but I want to expand in certain areas of my practice that I'm not currently doing. I'd like to have some clinical practice opportunities in these sorts of maybe rheumatology, endocrinology, cardiology. I would like to work in some areas that I'm not currently doing. Perhaps it's psychiatric or complex behavioral health or complex management. I'm not sure exactly of what you're looking for, but we want you to be able to look at your practice in a much broader, more complex way. So I'm so excited that you're looking at our program, and I certainly hope that you will apply and would love to talk with you further. If that's not enough, I didn't answer your question, please ask us further.
Okay, and for those, I see a few more are coming in now. Make sure that you log into YouTube and you can ask your questions in the chat box. So any questions that you have, don't feel afraid to ask them. That's why we're here on the webinar today, to answer your questions. Can you explain the on-campus weeks?
Yes, and we're really doing something new starting in May. The on-campus weeks in the past were opportunities to meet face-to-face with our faculty. You know, we're an online program, and we've heard from our students that has not been given enough time to meet online or meet face-to-face with faculty, and our students have said we want more opportunities. So starting this May, we have really expanded our on-campus week, and we're so excited about it. Some of you, particularly the student I just talked to who already has her NP certification, we're going to a more conference type activity. So students are going to be able to sign up for workshop type activities. We have a workshop in how do you read EKGs, a workshop for doing hands-on musculoskeletal assessments. One of our faculty who goes nationally in doing presentations for assessing shoulders and hips and knees assessments is going to be doing a workshop for better musculoskeletal assessments. We're going to be having a workshop directed toward billing and coding, so you can increase your knowledge about E&M, which some of you don't even know what evaluation and management coding, but to get better reimbursement. We've got one on how to do insertion of long-acting contraception. We've got workshops on dermatology, workshops on wound care. So our on-campus activities, which all students are expected to be here, and they're in May, August, and December, because again, we have an online, our courses are pretty much all online, our didactic courses, is to give students more face-to-face opportunities with faculty. You'll be here on campus, but they're more of a workshop conference sort of activities, and that's starting here in May, and it's more of an immersion sort of activity. So we think our students will be more excited about the learning opportunities that will be provided.
Perfect. The next question was, can you talk about any challenges that some of the DNP students might face?
And you know, I have 7 degrees. I can never say that because, you know, I graduated from nursing school when I was 19, and that'll tell you how old I am. So this year will be 45 years ago. And so, and like I said, I've been a nurse practitioner for 40 years. And so there are always challenges to academia. And the challenges have to do with trying to balance academia. Many of you are working. Many of you have families. And you know, somewhere in the midst of all that, you want a little bit of a social life, a little bit. So going back to school is always a challenge. the biggest challenge that we see with students is work. Trying to balance work and then, of course, family and academia. We used to at one time say, don't work. I would have to say that is certainly the biggest challenge that students have, is trying to integrate a work schedule with academia. Online, people will say, oh, well, it's all online. And that asynchronous type of learning environment is advantageous because you can do your coursework based around your own learning needs and your work schedule and your family schedule. So if you're one of those individuals that would like to get up at 2 o'clock in the morning and write your papers or, review your work or study your book, then that might be the best thing for you. But, trying to do testing and get ready, balancing your work schedule is going to be your biggest challenge. We find that some of the students who can work PRN and cut their hours back will do the best. So those of you that are going to try to work full-time, you might be able to do it that first year, but working full-time and going to school full-time will be your biggest challenge, and we really encourage students not to do that. I will just tell you flat out. I can remember doing my PhD and trying to be a full-time wife and mother, and going to school full-time was horrendous. I mean, I did it, and some of you will be able to do it, and many of you will not be able to do that. And the biggest counseling sessions that I have with students are the ones that are trying to work full-time and do academia full-time and raise a family full-time, or even not raising a full-time family. But that's the biggest challenge that you will face, and that we will talk with you when we're going over plans of study, and even in the interview process. That will be the biggest challenge that we will talk to you about if you're going to try to work full-time and do academia. Now, you might be able to do it, but I'm just telling you that on the front end.
Mm-hmm. How long is the program if you have a master's FNP?
About a year and a half. I'm going to look at some of that. It's usually about a year and a half, if I can remember about right, if you're going full-time. It's definitely about, if I can remember, can you remember some of those? And if you can answer another question, I will look at the plans of study.
Okay.
Here is one for like acute gerontology, acute care, full-time. But that's the post MSN, and you've got fall, spring, and fall. So it's about 53 overall with 780 clinical hours. So fall, spring, and you graduate in the fall of year 3.
So roughly about a year and a half.
About a year and a half.
Okay.
Full time.
Okay. And this one might go into that one as well. How many clinical hours are required for a MSN to DNP in family practice?
Well, they're both kind of about the same. So I'm looking at the adult one right now, and that's about 780 clinical hours. This is the psych mental health post MSN, and it's about 720. So I'm assuming that's probably true for about everybody. Let me let you know this. We believe that the doctorate in nursing practice is exactly what it says. It's nursing practice. We know that across the country, there are different types of DNP, particularly those that are postmasters. We feel very strongly at University of Tennessee Health Science Center College of Nursing that the DNP is a clinical-based doctorate, and therefore we feel very strongly that we should have strong clinical practice hours. There are other programs that are not necessarily plans to study that way, and their programs are not as strong based in clinical practice. But at our program here at the University of Tennessee Health Science Center, we believe it is a doctorate in clinical practice, and we focus very strongly on clinical practice hours, even if you are post-MSN. So we know that you're already a nurse practitioner, but we believe that as a clinical practice doctorate, you need those clinical practice doctors to help you think differently about the way you practice. And it's the way I was talking, I don't know if you joined later or not, we believe that you should have those clinical practice hours and think differently about the way you practice, that you may have practice hours in a different sort of practice than you're currently working, that you need to be evaluating your practice and think differently about the way you practice. So we believe very strongly that the DNP is a practice doctorate.
Okay, and we just want to mention again, we have a few, I see kind of the numbers going up and down. So for those who are just joining, we're kind of in the middle, almost closing out our DNP info session. But if you have any last minute questions, just again, log into Facebook, log into YouTube. Log into YouTube and you can put your question in the chat box and we'll make sure to answer those questions. So if you have any questions, definitely go ahead and ask those now because we will be closing out pretty soon. Someone asked about, go ahead.
I do want to say before we close out, because you will not see it on the program, it'll be probably a year away, but we will be developing, and we have just hired, and we will be developing an acute care pediatric nurse practitioner program. We're very excited about this. We have had our practice partners at Le Bonheur and St. Jude to ask for this. We have just hired Dr. Rickard, and she is an acute care pediatric nurse practitioner, and we will be developing and adding a new DNP program in acute care nurse pediatric. So if you are a pediatric nurse and you're thinking, well, I'm not sure if I really want to work in a pediatric or a family pediatric program. I'm really interested in staying more in the hospital. We're a year away of actually implementing that, but we will be implementing an acute care pediatric nurse practitioner. And the other thing that we will be doing within the year is adding into our acute gerontology acute care nurse practitioner program is the RN First Surgical Assist program. We will be adding that as part of our acute care program because of a request from our community partner. So that will be actually being added into our acute care, the RN First Clinical Surgical Assist.
So we have a lot of exciting new things going on. Up, yes. Someone asked if you, I guess, decide or get admitted into a certain concentration and you don't like it. Can you change? Switch? Or?
Absolutely. And that, I'm not saying it happens all the time, but it is an occasional happening. You know, we'll have somebody else say, you know, this is not, you know, they talked and they thought this was the way they wanted to go, but as they got into the option, decided, you know, this is not really the direction I want to go. And as I've been in there, I really would rather go. That certainly can. We have plans of study that happens all the time. We have people who go from full-time to part-time, or they start off part-time, and because their life changes, they decide, you know, I've decided that I really am not going to continue in my job and I'd like to go now. I'd like to go to full-time. Or because of life circumstances, I'm going to have to go back to work and I need to go from part-time to full-time. Or I've started off with the acute care and now I don't decide I don't really want to do the acute care. I'd really like to change over to family. Or what really we see happening more, you'll start off with the dual program and decide, I really can't do a dual program and I'd really like to drop back and only do a single program. So those sorts of things happen all the time.
Okay, I see the questions are kind of slowing up, so we're going to go ahead and close out. But before we do, I'm going to just mention a few last minute things. So if you have any questions, last minute questions, just go ahead and ask us those questions. But pretty much just in closing again, the applications will be up and ready for you soon. Nursing Cast, go ahead and, you know, like Diane said earlier, do your research. You know, we're here for questions. She's available, email. So if you have any questions about a certain concentration, or
do you want to get my email?
Yes, and I'm going to put that up on the screen. I'm going to go to our faculty, if I can find it over here. Yes, at the bottom. And my information is right when you log into our website, College of Nursing. You'll see Jamie Overton. She's the Director of Student Affairs. Her email and phone number is on there, and also mine. I'm the coordinator of student affairs. So if you want to come up for a tour, if you're going to be in town, or just any general questions, definitely send those our way as well. But anything that's kind of specific program as far as DNP, and I'll give it to you, Diane, you're down here somewhere.
And
I'm pulling up Diane information so you can just kind of here we go. I'm just going to kind of highlight that. And more importantly, you see her email. But yeah, she's right here. Okay. And she's the DNP program director, so she'll be able to kind of answer anything specific to the different programs or get you to the right program coordinator if you have any questions. I'm looking to see if we have any other questions. Diane, do you have anything in closing that you want to mention?
No, I just wish you all the very best as you are deciding your academic goals, your career goals, and you're deciding on what program that you would like to apply to. We certainly hope you decide on UT. I think, as I said, I've been in this area for a long time, and I think we have one of the best programs in the nation. So I hope you'll consider our program, and I look forward to seeing your application.
And also just want to note that this has been recorded. So if you have friends or someone who couldn't join us this morning, just feel free to, copy the link. You can send it to them and they can watch it over and over again because it's that good. But yeah, definitely pass the link on. So if you have anybody else that you know that couldn't join us this morning and want the information, they could just log on to our YouTube channel and it'll be recorded for you. But again, in closing, we thank you for joining us. And if you have any more questions, let us know. Thank you.